So, as I said before, ACT is very experiential. I try to talk about less about the then and there and bring it more into here and now. Learning how to develop awareness, mindfulness skills really is a whole nother skill set by itself. And just like any other skill, you have to practice it. So I tried to bring in as many in-session mindfulness exercises as possible. And also, learning how to slow down, observe our experience is also another way for us to facilitate internal interoceptive awareness of our body. And for clients, sometimes this can elicit a little bit more clarity in terms of their own gender identity. And so there's a few exercises I like to use with clients. Some are pretty familiar, probably to you all. Leaves on a stream, sky and weather visualization. One I like is called acceptance of thoughts and feelings. This one tends to take between 5 to 8 minutes. I'm going to try and walk you through it briefly now. This I'll typically do in session. And so ask the client to get in a comfortable position in your chair. Sit upright with your feet flat on the floor, arms and legs uncrossed, your hands resting in your lap or your leg. And you can allow your eyes to close. You can allow your eyes to, rest on a point in the floor, wall, just whatever works with you. And I want you to take a few minutes to get in touch with the movements of your breath and the sensations in your body. Bring your awareness to the physical sensations in your body, especially to the sensations of touch or pressure where your body makes contact with the chair or floor. Now slowly bring your attention to the rising and falling of your breath in your chest and belly. Like ocean waves coming in and out, your breath is always there. Notice its rhythm in your body. Focus on each inhale and each exhale. Notice the changing patterns of sensation in your belly as you breathe in and as you breathe out. Take a few moments to feel the physical sensations as you breathe in and as you breathe out. There's no need to try and control your breathing in any way. Simply let the breath breathe itself. As best you can, also bring this attitude of generous allowing and gentle acceptance to the rest of your experience. There's nothing that needs to be fixed. There's no particular state to be achieved. As best you can, simply allow your experience to be your experience without needing it to be anything other than what it is. Sooner or later, your mind will wander away from the breath to other concerns, thoughts, worries, images, bodily sensations, planning, or daydreams, or it may just drift along. This is what our minds do much of the time. When you notice that your mind has wandered, gently congratulate yourself. You've come back and you're once more aware of your experience. You may want to acknowledge briefly where your mind has been. There's thinking or there's feeling. Then gently escort your attention back to the sensation of breath coming in and going out. As best you can, bring a quality of kindness and compassion to your awareness. Perhaps seeing the repeated wanderings of your mind as opportunities to bring patience and gentle curiosity to your experience. When you become aware of bodily sensations and feelings, tensions or other intense sensations in a particular part of your body, just notice them. Acknowledge their presence and see if you can make space for them. Do not try to hold on to them to make them go away. See if you can open up and make some room for the discomfort, for the tension, for the anxiety, just allowing them to be there. Know that there is enough space in you to welcome all of your experience. Watch the sensation change from moment to moment. Sometimes they grow stronger, Sometimes they stay the same. Sometimes they grow weaker. It doesn't matter. Breathe calmly into and out of the sensations of discomfort, watching the breath moving into and out of that region from the body. Remember, your intention is not to make you feel better, but to get better at feeling. If you ever notice that you're unable to focus on your breathing because of intense physical sensation or discomfort in your body, let go of the focus on your breath and shift your focus to the place of discomfort. Gently direct your attention onto and into the discomfort and stay with it, no matter how bad it seems. Take a look at it. What does it really feel like? Remember, your intention is not to make you feel better, but to get better at feeling. Along with the physical sensations in your body, you might also notice thoughts about the sensation and thoughts about thoughts. You may notice your mind coming up with evaluative labels such as dangerous or getting worse. If that happens, you can thank your mind for the label and return to the present experience as it is, not as your mind says it is. Noticing thoughts as thoughts, physical sensations as physical sensations, feelings as feelings, nothing more, nothing less. To help you experience the difference between yourself and your thoughts and feelings, you can name thoughts and feelings as you notice them. For example, if you notice you're worrying, say silently to yourself, "Worry, there is worry." Just observing the worry and not judging yourself for having these thoughts and feelings. If you find yourself judging, just notice that and call it judging. There's judging. And observe that with the quality of kindness and compassion. You can do the same with other thoughts and feelings. Label the thought or emotion and move on. Thoughts and feelings come and go in your mind and body. You're not what those thoughts and feelings say, no matter how persistent or intense they may be. As this formal practice comes to an end, gradually widen your attention to take in the sounds around you. Notice your surroundings and slowly open your eyes with the intention to bring this awareness to the present moment and into the upcoming moments of the day, and bring your awareness into the room and back to us.